I reflect a glimmer of hope that the numbers are a little bit less this week, but then I hear the 40 people who died, and I recognize from my other role that we have been seeing a number of people dying in the community outside of the hospital, which is new, unfortunate, and sad, because these people have not been able to obtain health care because the disease affected them so quickly and so seriously, leading to deaths in the community, which we did not see in the Office of the Chief Coroner in the first wave, as many people had been in a different setting. So I continue to reflect on the significant number of people in the intensive care unit, the incredibly hard and challenging work of those people to try to get better, their families to support them, despite the fact that sometimes the people who are sick have been transferred hundreds of kilometers to another setting so that they can receive intensive care unit care, and the tragedies that still occur despite that care. So numbers are still very high in the hospital. We're seeing the deaths. We are making a difference. What I can tell you is the numbers have been certainly elevated in the range of approximately 2 per day over the past 2 weeks, and that is in excess of anything that we saw during Wave 1 and over Wave 2 as well. We are seeing them in a range of ages from a younger age in their 30s up through into their 70s, and many have either had a test positive or are associated with people who were test positive, and that they have had symptoms, and then those symptoms have been present, not to the extent that were recognized as necessarily requiring hospitalization, and then they were found deceased later in the day or in the morning. And so we are still evaluating and trying to understand all of the circumstances, but certainly it's notable in the fact that this is a younger population, this is a population in the community, this is a population who are suffering serious consequences in the form of death in a quicker period of time that we saw in the past. These are not people that ambulances have been called because they've been deteriorating. Many of these people were found deceased. The symptoms, when I've read through the information of the significance of the symptoms, these were people that weren't necessarily appearing based upon their symptoms to be needing to go to hospital or an ambulance to be called. So it's not that people were ignoring symptoms from what I've read in them. I need to drill down a little bit deeper, but these are people who did have stable condition and then deteriorated very quickly to their unfortunate deaths. So I think it amplifies and recognizes the importance of what we need to do to ensure that we reduce the potential for people having infections. I go back to what Dr. Williams was answering, the difficulty of the healthcare system. We want to ensure that everybody is provided the best opportunity to not have to suffer and not have to enter into the healthcare system.